Congratulations on your implant placement. Dr. Jason Wong and his team have put together this video demonstration for you. In this video, we will be discussing bleeding, the healing process, swelling, eating, oral hygiene, as well as the prescription medications that were prescribed to you. For the remainder of the week. For the remainder of today, you will be bleeding a little bit. We ask that you not spit. Spitting will only prolong the bleeding as it will dislodge the blood clots. If you feel like you need to clean your mouth, we ask that you take a paper towel and just wipe the inside of your mouth. We ask that you do not use a drinking straw. Using a drinking straw can dislodge the blood clots in the area, causing further bleeding. Drink directly from the cup. You may also use a spoon. For those of you who smoke, we ask that you refrain from smoking several days following your implant placement and/or bone grafting. Smoking will only increase the chance of infection as well as compromise healing. Bear in mind that smoking will also compromise the longevity of your implants. Take care not to dislodge your blood clot. Poking the area with your fingers or your tongue will cause unnecessary bleeding. Let's talk about bleeding. With implant placement and bone grafting, bleeding is rather minimal. If you do see a little bit of bleeding following your procedure, you are welcome to use a piece of gauze that would have been provided to you. Just take your gauze, fold it in 4, and place it directly on the surgical area. We ask that you not put any excessive undue pressure on the area. This can compromise the bone grafting site or the implant site. So really what you want to do is just help with the blood clotting. So gentle pressure on the area, changing the gauze every 20 to 30 minutes. If we placed implants in the upper area near your nose, this is close to the sinus membrane. There is a slight possibility that you may have bleeding or discharge from your nose. If this does occur, please pinch your nose and let it pass. It will stop quickly. We also ask that you not drink from a straw for 7 days or blow your nose for 7 days. Healing process for those who had bone grafting. For those of you who had bone grafting, we ask that you not apply any direct pressure on the area. This includes gauze as well as chewing directly on the area. This will compromise the healing. We want the area to heal beautifully for your future implants. I know that you may be curious to see what the area looks like, but we ask that you not pull your lip to see the area. Pulling your lip can damage the surgical site as well as cause tearing in the area. We ask that you leave the area alone. For those of you who had bone grafting, you may sense a sandy taste in your mouth the day of or days following your bone grafting procedure. Don't be alarmed by that. Dr. Jason Wong would have deliberately overpacked the area. So we may lose a few of these small granules along the way. Swelling. Swelling is normal following implant placement and/or bone grafting. Some people may experience swelling and some may not. With implant placement, swelling generally tends to be quite minimal. We will see a little bit more swelling with bone grafting procedures. Swelling will worsen day 2 day 3, and day 4 following your implant placement and/or bone grafting. Do not be alarmed by a little bit of increased swelling along the way. Swelling can last for up to a week or longer, and that's okay. Some bruising on your face is normal following your procedure. It's part of your body's natural healing process. Don't be alarmed if you see some bruising either on your neck, jawline, or under your eyelids if we placed implants on the upper side. With time, the bruising will subside. There are several ways to alleviate swelling. Number 1, ice your face. Take an ice pack and place it externally where we placed your implants or where we performed your bone grafting. Place it externally for 20 minutes on, 20 minutes off. 20 on, 20 off. If we placed implants on either side of the face or bone grafting performed on either side of the face, then you want to alternate. 20, 20, 20, and you want to do that for the remainder of the day of your procedure as well as the day following your procedure. Number 2, now that it's bedtime, we're not going to ask that you ice your face, but rather elevate your head. So with a couple of pillows, prop yourself up. That elevation will help keep the swelling down over the next several days. The number 1 question everybody asks, what can I eat? You may go ahead and start eating as soon as you return home from your surgical procedure. We ask that you try to avoid chewing directly on your surgical sites, or you can eat soft food on the area. Try to avoid temperature hot food on the first day, as this will only promote bleeding. Temperature cold, such as ice cream and milkshakes, are great. It feels good and it helps alleviate the swelling. But don't forget, try to avoid that straw. For several months following your implant placement or bone grafting, we ask that you not chew any hard foods on the surgical area. Chewing hard foods such as nuts will compromise the stability of your implant. So we ask that you only chew soft foods on the surgical area. Stay well nourished and well hydrated. This will ensure that you heal faster and more comfortably. Brushing. We ask that you do not brush your teeth or rinse your mouth the day of the procedure. This will only compromise the surgical areas, prolonging bleeding. The day following your implant placement or bone grafting, you may go ahead and start brushing your teeth, avoiding the surgical areas. Dr. Jason Wong would have placed some stitches in the area. Some of those stitches may be dissolvable and some of them may not be. He will advise otherwise if you need to return to remove your stitches. You may start brushing the surgical areas 1 week following your procedure. We ask that you take a clean, soft toothbrush and brush directly on your surgical areas very gently on those stitches. Please do this 3 times a day. Rinsing. Again, we please ask that you do not rinse your mouth the day of your procedure. We ask that you start rinsing gently the day following. If you are prescribed a medicated mouth rinse, the medication would be called Paradex. Paradex is to be started 1 day following your implant placement or bone grafting. You're going to use this 5 times a day. Paradex can discolor the teeth and tongue, so we ask that you brush your teeth and tongue prior to using your mouth rinse. Again, no rinsing the day of your procedure. Following your implant placement and bone grafting a day after, you may go ahead and start rinsing with warm saltwater rinses if you were not prescribed a Paradex mouth rinse. You're going to take a cup of warm water with half a teaspoon of salt, and you're going to just gently, not aggressively, gently swoosh for 30 seconds and open. Don't aggressively spit out, but rather let the water drizzle out of your mouth. You want to do this 5 times a day. The antiseptic mouth rinse, whether it be the Paradex or the warm saltwater rinses, act as an antiseptic to prevent infection. We ask that you do this 5 times a day for 1 week following your implant placement. Let's review your prescription medications. You may have been prescribed several prescription medications following your implant placement and bone grafting. We ask that you continue with your medications and follow the instructions that were given to you by your nurses. Some of the medications may cause a bit of stomach upset. We ask that you take all of your medications with a full glass of water and with a little bit of food. If you experience any nausea, vomiting, or diarrhea, we ask that you please contact us. Your antibiotic that was prescribed to you is to prevent infection. We please ask that you continue to take your entire course of antibiotic. We thank you. We hope you have a smooth recovery. If you have any questions or concerns, feel free to connect with us.